Zamorano. I'm going to talk about tuberculosis. Tuberculosis, or TB, is a also called Placeitis pulmonaris or consumption. It's a common and in many cases fatal infectious disease caused by various strains of mycobacteria, usually Mycobacterium tuberculosis.
It doesn't get any more alarming. As you watch this story, India is being gripped by a lethal mutated strain of tuberculosis which has no cure. In the last 3 months alone, Hinduja Hospital in Mumbai has identified 12 cases of total drug-resistant TB, meaning it cannot be treated by any known antibiotics. 3 years ago, Iran was the first country to report one case of this deadly tuberculosis. Now, India has found 12 such cases. And what's worrying is the fact that 10 out of these 12 cases are from the city of Mumbai. And with no government regulation in place for isolation, these patients who suffer from a highly infectious, incurable disease could be.
Most infections do not have symptoms, known as latent tuberculosis. About 1 in 10 latent progress to active disease, which if left untreated kills more than 50% of those infected. The classic symptoms of active TB infection are chronic cough with blood-thinning sputum, fever, night sweats, and weight loss, the later giving rise to a formerly common term consumption. Tuberculosis typically attacks the lungs, but also can attack other parts of the body. It is spread through the air when people who have an active TB infection cough, sneeze, or otherwise transmit respiratory fluid through the air. Infections of other organs cause a wide range of symptoms. Diagnosis of active TB relies on radiology, commonly chest X-rays, as well as microscopic examination and microbiological culture of fluids.
Has identified 12 cases of total drug-resistant TB, meaning it cannot be treated by any known antibiotics. 3 years ago, Iran was the first country to report one case of this deadly tuberculosis. Now, India has found 12 such cases. And what's worrying is the fact that 10 out of these 12 cases are from the city of Mumbai. And with no government regulation in place for isolation, these patients who suffer from a highly infectious, incurable disease could be anywhere in the open. On an average, in a year without isolation, one TB patient infects at least 15 to 20 others.
Diagnosis of latent TB relies on the tuberculin skin test and a blood test. Treatment is difficult and requires administration of multiple antibiotics over a long period of time. Social contacts are also screened and treated if necessary. Antibiotic resistance is a growing problem in multiple drug-resistant tuberculosis infections. Prevention relies on structuring relationally with the bacillus Calmette during the vaccine. Tuberculosis may affect any part of the body, but most commonly occurs in the lung, known as pulmonary tuberculosis. Extrapulmonary TB occurs when tuberculosis develops outside of the lungs, although extrapulmonary TB may coexist with pulmonary TB as well, and this is a bad prognostic disease.
Include cough, chest pain, shortness of breath, fever, sweating at night, poor appetite, weight loss.
Finally, general signs and symptoms include fever, chills, night sweats, loss of appetite, weight loss, and fatigue. Significant finger clubbing may also occur.
Lower, and this will be the middle lobe. And you're minding your own business and somebody coughs and they get TB in your lungs. So that TB gets inhaled, you breathe it in, and the location that the TB likes to go to is actually a pretty interesting thing, is it likes to go along these fissures that I'm drawing out here. So these are the fissures, they separate the lobes of the lung, right? They're kind of like the boundaries. And so they like, the TB bacteria, they like to go near those.
Thank you.